Hi, this is Guy Hazer from Austmedics. If you're looking for a position in Australia, give me a call or email me, and I'd love to help. Let's look at what a GP can earn in Australia. Probably the number one question I get asked, how much can a GP earn in Australia? First thing to do is to understand how a GP earns in Australia. All GPs are contractors. They have to pay their own holiday, superannuation, their own tax. They typically are paid as a percentage of billings. Unless you're working for a government health department, you'll be paid as a percentage of your billings. So it's a fee-for-service model. You would typically receive somewhere between 60 and 70% of billings, but 65 is what I see most being offered by practices. As a contractor, you determine how you practice. So you determine how many patients you see a day, whether you spend 6 minutes with a patient generally, or 15 or 20 minutes. You can see as many patients as you like per day. It's entirely up to you. And generally speaking, hours you work are pretty much under your control. Although practices will want to see you doing sort of 3 to 4 days as a minimum per week. One of the important distinctions and things to bear in mind is you are responsible for your billings. So if a practice manager says to you, oh no, this is the way it's done in Australia, everybody does this, just be careful, because you're responsible. So the nurses can say whatever, the practice manager can say whatever, you're responsible. So on that, Medicare runs an audit program. They've got an algorithm. They look at who's billing what. So if you're an outlier on the bell curve in either total billings or the items you're billing, they may ask to do an audit, and you need to be able to have good notes and a good history to justify why you've billed whatever service. So typically you'll see most GPs are billing somewhere between 400 to 600. And one interesting thing is, so the 99th percentile of GP billings is about 800,000. However, if you fall foul of some of the rules, particularly the 80-20 rule. So the 80-20 rule is if you render more than 80 individual items or services per day for more than 20 days, you're automatically deemed to be practicing inappropriately, and they will want a refund for all of those days that you've been practicing inappropriately. So just something to be, to bear in mind. It's individual services you've rendered, not the number of patients per day, but you just need to be aware of it. The other thing is, most practices won't refund you the management fee, so they've taken 35% of your billings to provide, the practice, the nurse, the receptionist, the building, and that sort of thing. And if you have to refund to Medicare, they won't refund your management fee. So you end up having to pay both 100% of the billings you've raised, which have been disallowed, as well as the management fee on top of that. So that, it's just something to be a little careful of. So that's how a GP earns. Now let's look at some more detail. The billing system is something you need to understand. So it's a fee-for-service model. A patient is billed for each service you render. Now, one of the typical items, as Medicare calls them, is an item 23. So that's a standard consultation between 6 minutes and 20 minutes, and that's what you'll be rendering most. Now, there are different types of billing systems. There's bulk billing, where the patient, for example, you see the patient, it's a 7-minute consultation or a 15-minute consultation. You then bill Medicare an item 23. They will also potentially, if they've got a concession card, you would receive another $10 on top of the standard fee because you're bulk billing people with concession cards. Now let's contrast that with a private billing system. The same patient comes in, potentially, and you see them for 7 minutes. You would say, oh look, I'm going to charge you privately and I'm going to charge you $70. And what happens is when they go to pay the $70, Medicare immediately credits back the $37, which is the standard Medicare rate for an item 23, and the patient pays $70 and they're left out of pocket by $33. Now, a mixed billing system is a combination of the two. For patients with a concession card, they are bulk billed, so they don't pay anything. The bill is sent straight to Medicare, and you as the doctor receives a standard rate for that service. For people who are working, you would then charge them privately for the consultation. But it's completely up to you how you bill. So, if you're in a private billing system practice, you may, if someone says, look, I can't afford anything, and you agree that they probably can't afford anything, you're perfectly entitled to say, oh look, I'll bulk bill you this time. But also you can mix it, so you could be private billing for the main consultations, but all the ancillary items, like a chronic disease management plan, you may say to them, look, I'll bulk bill you for those additional services. So it gives you a lot of flexibility. So let me just look at some items, and that will give you some flavour as to how you bill as a practitioner. So here's a list of items that are frequently used by GPs. So you'll see, a brief consultation under 6 minutes, Medicare pays $16.95. They also, if you look down to the bottom of the page, the third item from the bottom, there's $9.25, the 10991 incentive. So that applies to each service you render if they hold a concession card. So item 23, the standard consultation. It has to be more complex than a brief consultation. It has to be less than 20 minutes. You need to take a history, and you will receive $37.05 for that consultation. There's some mental health items. And let me just sort of illustrate how you'd bill. So you see patient number 1 on the right-hand side of this page for 27 minutes. You bill them an item 23. So you saw for sort of their general health, you had an issue, you dealt with that, and it took 7 minutes. But also they had, there was a mental health attendance, and you spent 20 minutes because that's the requirement, lasting, if you look at 2713, other consultations, it says attendance in relation to a mental health order lasting at least 20 minutes. You receive $71.70 for that, and you billed that. You also, in this example I'm using, that person received, has a concession card. So for every item you've billed, the 23 and the 2713, you receive the incentive for each of those items. So you receive $9.25 and $9.25. Similarly with patient number 2, 7 minutes, item 23, but they had a concession card, they got the $9.25. You receive the $9.25. Patient 4, 15 minutes, simple item 23, they don't have a concession card, and you're in a bulk billing clinic, therefore you just received the $37.05. Patient number 5, it's an 11-minute consultation. They have a concession card, get $9.25. In this example, you receive the total billings are $256 for that hour, and you would receive $167 of that at 65% of the total billings. In October 2016, it's around £100 for that 1 hour's work. That just gives you a flavour of how you build the build towards the $2,000. And in my experience, a lot of GPs just going to private billing practices versus bulk billing practices. The reality is 85% of practices in Australia bulk bill. So unless you're in a particular location that will either have no choice, so if you're in the middle of nowhere in rural Australia, I've seen a lot of practices are only privately billing because it's 2 hours drive to the nearest other GP. So they've got a captive market. They privately bill all their patients, children, unemployed, everybody. That's the reality. The other extreme of that is in very wealthy suburbs within major cities, they may be in a position to private bill all their patients as well. However, my wife insisted I get her a private billing practice, and she didn't stay there particularly long because she makes more money in a bulk billing or mixed billing practice. The reason for that is, if you're sitting around for an hour and a half because no one's come in, because the practice is not billing for that hour and a half, you've lost, $300 or $400 of billings because it's a private billing practice. So patient numbers can be a problem if you are private billing. So it's not all that it's paid. If every practice in Australia was private billing, then it wouldn't be an issue. But given the competition for patients, and people were happy to spend $100 on their hair, but don't really, if they can see a free alternative, they don't really want to pay privately for a GP, unfortunately. Here another list of items. I guess one of the key things to be successful in Australia is to manage your chronic disease patients, and there are a whole lot of items which allow you to do that. There are also health assessments which apply to under 5-year-old children. You can do a health assessment on patients who are 40 to 49. You can do them health assessments for over 75s. They're lucrative, particularly where you can also utilise the nurse time to do a template driven questionnaire. That nursing time counts as your time, and you can bill that. So, for example, if a nurse spent 40 minutes with the patient and on a health assessment, and you then spent 21 minutes, so over 60 minutes, you can bill item 707, which is $268 for 20 minutes of your time. So it's equivalent to QOF. You need to get patient consent. There are a whole lot of rules around it. You need to familiarise yourself with the rules around a chronic disease management plan. You can only do one a year. You can do another review once a year. But you need to just be familiar with what the rules are. But once you understand the rules, they're worth doing. But you need to get patient consent. You need to sell the concept. Hi, you've got diabetes. I'd like to do a chronic disease management plan for you. We find it very useful to manage your diabetes with that plan. The other thing is you can't access, say dietitian services, or on a mental health plan, you can't access to psychology services without those plans. So it's a gateway to allied health as well. So that gives you a flavour of items and fee for service. So as I said, the other thing that's to bear in mind is there are no patient boundaries in Australia, or practice boundaries. So patients can go to different practices, right or wrong, that's the reality. There's no boundaries so there are some issues in terms of doctor shopping for prescription drugs. They're developing a system called Schedule 8 drugs for most of the opioids, so that they're centrally monitored by patient. So if they go to 3 different doctors on the same day asking for oxycodone, that will flag up. But it is patient choice. So if you're a good doctor and you're popular, you'll have lots of patients, and you'll do well. Let's look at typical GP. So I'm very comfortable. In my experience, all the UK GPs are capable after 2 or 3 months of billing around $2,000 a day. So on a 65% practice, you would receive $1,300 a day. So these are how I arrive at my figures. I am very confident on those figures. So total billings of $2,000 a day, take home at 65% would be $1,300 a day, which equates to about $300,000 for a 5-day week, 47 weeks a year, which is about £186,000 in current exchange rates. If you do less days, clearly you're going to be earning less. Here's some examples of UK GPs who are working in Australia. These are real data from those GPs. So let's look at those. So GP number 1 is a male GP. He works pretty hard. The 51 hours on the first line, he did do the Saturday as well, but the other 2 45-hour weeks are just Monday to Friday, and he's billing, he's earning around 14,000, depending on how many patients and how long he works, and he is making around 600,000 a year. That's $600,000 a year. The second GP is same practice, and she's from the UK, and she's doing clearly less hours, but on the whole, she's earning very well. And if she doesn't have holidays and that sort of thing, it's around $500,000. But I would expect her to be earning around $450,000. So there's 2 real life examples. The next one is another UK GP. These are his billings, total billings, and clearly he's hitting the sort of $2,500 a day of total billings, which equates to depending on his percentage, but 65%, for example, he'd be taking home $1,500, between $1,300 and $1,500 a day. So that gives you a flavour of real life billings. There are a couple other ways to boost income. If you're lucky enough to work in an accredited practice that does teaching free for medical students, you'd receive $400 a day. One of the other things that's worth looking at, if you like A&E work, you can earn $17,000 tax-free in Australia with salary sacrifice in hospitals. But that's worth exploring if that's your cup of tea. Anyway, I think that's it. Hopefully that's been useful. And look, if you want to have a chat, I'm very happy to help. We have extensive contacts out Australia. My name's Guy Hazel, and this has been a presentation by Austmedics. Thank you.